Here we go.
Grand Rising, Elizabeth.
Grand Rising.
Grand Rising.
You know, today I am joined by Nurse Stacy, my co-host, and she's a registered nurse, and I will affectionately call her a problem solver. Nurse Stacy specializes in providing a clear roadmap for your health journey. She has spent years answering the why behind common health struggles. And today, she is here to share the following insights with you. The topic is metabolic syndrome, the hidden drivers of disease. And the focus is blood pressure and glucose monitoring. Presenting Nurse Stacy.
Thank you, Deetra. So this topic came about by request. It was requested that I talk about high blood pressure and glucose monitoring. And I thought it was a great topic to talk about, because I've always been like passionate about metabolic syndrome in and of itself. So um, I'm glad to be able to speak about this today. And I want to welcome everyone and thank everybody for being here. So metabolic syndrome is something that affects millions of people, but it often goes unnoticed. And we'll focus especially on blood pressure and glucose monitoring because these two areas is where awareness can truly change the outcome. So let me go ahead and share the screen. If you give me permission to share the screen, I'm going to pull up. Hold on, pull this up first. Uh-oh. Can you see my screen?
Yes.
Yes.
Awesome. Let me hide these controls from me. And give me a second for this to populate. There it goes. Metabolic syndrome, the hidden driver of disease. And like Deetra said, the focus is going to be on blood pressure and glucose monitoring. So what do high blood pressure, belly fat, and blood sugar, what do they all have in common? So that's what we're going to talk about. So let me just move on here. So, what is metabolic syndrome? So, metabolic syndrome isn't just one disease, it is a cluster of conditions that occur together and increase the risk of heart disease. It increases the risk of stroke. It increases the risk of diabetes. And these include the things that increase this risk: high blood pressure, high blood sugar, excessive abdominal fat. And mind you, we can have an excessive abdominal fat and we not even see it. It could be on the inside. They call it skinny fat. And also abnormal cholesterol levels. When these happen, when these are paired together, they create a much higher risk than any one factor alone. And that's why they call it a syndrome. As in, you can see there's 5 criteria here. And you only need to have 3 of them to qualify for metabolic syndrome. And as you see, it's abdominal obesity, high blood pressure, elevated fasting glucose, high triglyceride levels, low HDL levels. So it's not, like I said, one disease, it's a pattern. And it's all driven by insulin resistance. So it's important to note that because metabolic syndrome often develops silently, many people feel fine until serious complications arise. And a lot of times people say, oh, I never had blood pressure before. Why is this all of a sudden happening to me? So it significantly increases the risk of type 2 diabetes because of this whole metabolic syndrome. It increases the risk of cardiovascular disease and even cognitive decline. But the good news is it's largely preventable and it's also manageable. So that's what we're going to keep our focus on. It's preventable and it's manageable. The five main components, like I said, is the ones that you see right here. And having three of them qualifies you for having metabolic syndrome. So let's do a little deep dive on high blood pressure. What is it? So high blood pressure, or some people call it hypertension, is often called, anybody know?
Uh, mm, it is another name for it. Yeah, I
High
can't.
blood pressure or hypertension is often called, one more time, I know you know it. I know you heard it before at least. I'll give you the
I know
first.
when you say it, it's going to be like, oh,
I
yeah.
know exactly.
It's only two words, and I'm going to give you the first word. Silent.
Oh, killer.
There we go.
Oh, yeah.
It's a silent killer.
Yeah.
And people don't know that. It's a silent killer because it typically has no symptoms. You don't
Mm.
even know it until it's just like, boom, it's there.
Bam.
Over time, what high blood pressure does is it damages the blood vessels. And over time, it's increasing your risk for a heart attack,
Yeah.
a stroke, and kidney disease.
You know, as you talk, I'm thinking, is that the reason my sister died of cardiac arrest? Because of high blood pressure. We don't know.
Mm-hmm. She had high blood pressure.
I don't know. I
Mm-hmm.
don't know. But I'm thinking, I'm wondering now.
Yeah, it's a silent killer, and people are not realizing what drives it. Why does it get to the point where we have hypertension?
Right.
Why do we get hypertension? Of course, as we get older, our bodies age anyway, and our vessels age, everything ages. And as we get older, that puts us at higher risk. But when you have some underlining things or lifestyle that you do, it perpetuates it and makes it worse.
Yeah.
So, like I said, there's no symptoms, and over time, like it don't happen overnight. Over
Right.
time, it damages blood vessels, increasing your risk for heart attack, stroke, and disease. So normal blood pressure is around 120 over 80. Now, it used to be hypertension, as you can see on the screen, it says more than 130 over 80. That's the current guidelines. The guidelines previous used to be 140 over 80,
Mm.
140 over 90 is what it was. And then now it's changed to 130 over 80.
It's coming down. Mm.
And so I don't know if that's an attempt to put people on medication or if it's really proven to be 130 over 80. Is that proven to cause your vessels to be damaged? Is it proven to increase your risk for heart attack, stroke, and kidney disease? I don't know, but I know that over time they change a lot of things. They've also changed glucose numbers. It used to be, I think it used to be like 115 up to 115. Now they got it down to 70. So it constantly keeps going down. And when it constantly keeps going down, 70 is supposed to be normal. Anything under 70 is too low.
Mm.
But when it constantly goes down, it's just like, okay, another medication I have to add,
Mm.
or do I want to do some lifestyle changes here?
Yeah.
And
Stacy,
so, yes,
what, explain the 80, the bottom number.
the bottom number is, see, the way your heart works is it contracts and it relaxes. And I want to be able to explain this the right way. So one of them, the top number either contracts or relaxes. Let me get that for you.
Mm-hmm.
Hold on. Yeah, it's good to know.
It is.
Yeah, because usually you like, oh, my blood pressure is 180, my blood pressure, and I okay, I get that, but I never got what's your bottom number? Uh,
Yeah.
you
A
know,
lot of times my bottom number is really low, like in the 60s. And sometimes if it go below 60, um, that's the indication that I may be a little bit dehydrated, you know.
That
But
okay,
makes
it
sense.
says blood pressure is written as two numbers, 120 over 80. And each one tells you something different about how your heart and blood pressure is working. The top number, which is called the systolic pressure, it measures the pressure in your arteries
okay,
when your heart is squeezing or beating, like boom, you have the boom, boom. When your heart is squeezing or beating, think of it as the push of blood being pumped out, because our ventricles, we have the atrial and the ventricles, atrium and ventricles. The atrial is the top part of your heart. The ventricle is the bottom part of your heart. The bottom part of your heart pushes the blood to the top part of your heart. And from the top part of your heart, it goes through the aorta, which feeds every part of your body, including your brain, coming down into your stomach, your abdominal aorta, and feeding all of your organs with the oxygen that it needs, because the heart and the lungs work together to give your body the oxygen that it needs. So you think of it as the push of blood being pumped out. The example in 120 over 80, the 120 is systolic. If this number is high, it means your arteries are under more pressure every time your heart beats.
mm,
Okay. Okay.
Okay. And the bottom number, which is called the diastolic pressure, this is the second number. It measures the pressure when your heart is resting between beats.
Mm.
Okay. This is when your heart fills with blood. Like I was telling you, the heart with the atrium and ventral, the heart is being filled with blood and it goes down into the ventricle. When the heart refills with blood, the example of the 120 over 80, the 80 is diastolic. This number, if this number is high, it means your blood vessels are staying under pressure even when the heart is at rest.
Mm.
That's not good.
Mm.
And what can happen over time with high blood pressure? Those ventricles, the atrial and the ventricle, those ventricles can become hypertrophic, meaning they get fatter.
Mm.
And because it's a muscle, and if it's working hard, if we must work our muscles hard, those muscles grow, right?
yeah,
Well, if the muscle and the heart at the bottom are working hard, it's going to grow. And you don't want your heart muscle to grow, because it's going to call it's called hypertrophic, I believe it's called. If it grows, it gets stiffer and stiffer, just like the muscle gets stiffer and stiffer. And the stiffer it gets, the less able it is to pump the blood up.
Mm. Okay.
So you want the blood to be able to pump up into the atrium so that the atrium can do its job in sending the oxygen out to every organ in your body.
Wow.
wow.
I know.
Yeah.
Thanks for breaking that down.
Yeah,
Yeah,
thank
Yeah.
you.
So
Thank
the
you.
heart and the lungs work together, right?
yeah,
So when it pumps blood up, it pumps it from the left side. And in the left side, you have this vein that comes off of the aorta, because the aorta is the biggest artery in the body. So when it pumps it up from the ventricle into the aorta, it's this vein on the side called the what do you call it? Carotid artery. I think it's a carotid artery. And that feeds your brain. And that's why if things are not right or the pressure is too high, people can have a stroke because the stroke affects the brain. And so if you have to look at it this way, this is the heart pumping. We have it divided like this. You have the ventricles at the bottom and the atrium at the top. And then you have this one feeding the brain, this one going out to the rest of the body. I think it's just two. This one going out to the rest of the body. And so when it goes up, it feeds the brain, and then it comes out this way, come down to the center of your heart. Because what can also happen, it happened to my husband. It's called a AAA. And a AAA is an abdominal aortic, which is the aorta, like I said, the biggest vein,
Right.
abdominal aortic aneurysm. And an aneurysm is when it gets too big, it will get a slit in it, it will bust, and you'll start bleeding out.
Mm.
And so over time, if that pressure is keep building up, the vein can't take it anymore, the vessel can't take it, the artery can't take it anymore, and it will bust on you.
Yeah.
And the same thing happens in the brain. It can bust on you. And that's something that you don't want to have, because we have to really, 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 really take high blood pressure very seriously.
Yes, yes, yes.
So is that one more question? Is that when you said it gets in when it busts in the brain, is that the aneurysm?
You can get an aneurysm in there. Yeah.
That's what that, oh, okay.
Oh,
All right.
no. Well, a
Or is
stroke
that
is
the
different than
stroke?
an aneurysm. A stroke is different than an aneurysm. And I'm
Yeah.
not 100% clear whether the aneurysm is from the pressure being high or not. I'd have to look that up. It is an aneurysm due to your blood pressure being high. High blood pressure can contribute to an aneurysm, but it's not the only cause. An aneurysm is a weak spot in the blood vessel wall that bulges out like a worn spot in a tire. And how blood pressure plays its role in it, hypertension puts constant force on your artery walls, like we said before. And over time, that pressure can weaken the vessel wall, stretch it out, like it did in my husband for the aneurysm, this abdominal, increases the chance it will bulge, form an aneurysm, which is a bubble, or even a rupture, which happens to my husband. So it forms a bubble, an aneurysm, and the aneurysm can rupture. So yes, high blood pressure is a major risk factor, especially for dangerous types like brain or aortic aneurysms. And it contributes over time. So the blood pressure, the normal blood pressure, like I said, is 120/80. Elevated blood pressure starts above that. And hypertension is generally diagnosed when it reaches 130/80 or higher. And many people live in this range without realizing the long-term damage being done. So high blood pressure isn't just about salt, because a lot of people say, you got high blood pressure because you eat too much salt. It's not just about salt, but it's also about sugar and insulin. And there is a connection there. So in metabolic syndrome, high blood pressure is often linked to insulin resistance. How many knew that?
Well, it makes sense, but I didn't know it directly. It was, but
it's linked. It's surprising of how many different things in our body is linked to how many different things. Our bodies are made like dominoes. Like once one goes down, they all go down.
Right. They depend on each other.
Yeah. You got to
right,
keep one up to keep them other ones up. So high blood pressure is often linked to insulin resistance. The body's inability, this is what insulin resistance is. The body's inability to use insulin properly, which leads to inflammation and changes in the blood vessels. And this is one of the reasons why people, when they're diagnosed with diabetes, they automatically put them on a high blood pressure medicine because they know that that connection is there. And so it leads to inflammation and changes in the blood vessel, which increases pressure in the system. So on the screen, we have here the connection. Insulin resistant leads to higher insulin levels. And I can explain insulin resistance like this. And I know you probably heard me explain it like this before. Insulin resistance is when your diet consists of highly processed foods or foods that cause inflammation in your body, foods that will trigger your pancreas to release more insulin than it normally would release, will cause insulin resistance. It's what they call a spike, and a spike looks like this. Whereas, say you ate a piece of fish, you won't get a spike with fish because it's protein and it doesn't have carbs in it and it doesn't send spikes. But if you eat some sugary, like it can even be watermelon or mango or something that's really high in sugar content is labeled under healthy foods, it could still spike it. And so when you get a spike, what your pancreas is having to do is put more insulin on board to bring that spike down. Now, people who don't have diabetes, they can get a spike and it'll come right back down within 2 hours. And that's how you know your pancreas is not getting away too much insulin, because it goes up and it comes right back down. But if it comes up and then it's going like this over time, and then after 3 hours, it starts going down, that stayed spiked too long. You want your spike to come down within 2 hours' time. So what your pancreas is saying, if it could talk, it's saying, I am tired of making too much insulin for you to keep your glucose levels in check. I've been doing this year after year after year, and you have worn me out. And I'm about tired of you wearing me out. I don't have much more to give. I've been giving for years. How much longer are you going to make me keep giving? I don't have enough to give you anymore. I'm tapped out. Quit asking me to give you more of something that I don't have. So now, since you think that I'm going to keep on giving you insulin to bring your glucose in check when I don't have it to give, now I'm going to make you a diabetic. I'm going to increase your blood pressure. I'm going to mess up your kidneys. I'm going to screw up your liver, put fat in it. All of these things happen as a result of constant begging of your pancreas to make more insulin to keep your glucose levels down. And that's why it's so connected and correlated with high blood pressure. Because if it's having to work that hard, guess what? The domino effect is happening, and it's making everything else work as hard. It's making your heart work as hard, making the blood pressure go. It's making your kidneys work as hard, causing you to have kidney failure and all of these different things. So insulin causes sodium retention. Too much insulin, sodium retention. Think of it that way. Insulin, sodium retention. We related. We cousins. We blood related. That's what they're saying. We're related. Blood vessel constriction, when it's constricted, leads to raising your blood pressure. And that's very important to remember. So glucose monitoring. Most people only check sugar if they're diabetic. But guess what? That's outdated now. And a lot of people have proven that. You will see it all on the internet and everywhere. They'll say that is way outdated. If you eating, you need to be checking your glucose. And one reason why it's a good reason to check your glucose, because you can see in real time what your body or how your body is reacting to what you just ate.
That's true. Yeah.
Who wouldn't want to know if what they just ate put them at risk? The blood sugar levels are a critical part of metabolic health. When glucose stays elevated over time, it damages, just like if your blood pressure stays elevated over time. It damages blood vessels and organs, kidneys, even before diabetes. Now, this is the catch. It damages blood vessels and organs even before diabetes becomes an official diagnosis. Imagine that. So so on here we have two ways that you can do that. You can do it through a finger stick glucometer, where you just poke your finger and you put it on the thing and you get your number right away, or you can do it with a continuous glucose monitor. I choose the continuous glucose monitor because I always want to see, and I'll show you what mine look like. I always want to see what my numbers look like. Right now, this is my number. Can you see that? I don't know if you can see it or not.
Not with because you're little.
Now you can see it.
Okay, now
Yeah, right. Yeah.
This is my current number in real time, 96.
okay.
Not bad. And if you can look at it, let me see. You see that line there? I don't know. That line there?
Yeah.
You see how steady that line is?
Yeah.
When your line is steady like that, that's a good thing. Now let me see if I can find it when it wasn't so steady. Over 20. Oh, okay, I got a good picture right here.
Yeah.
What did I eat? I ate some rice. Okay, there we go. Look at that.
Wow.
Woo. That's all
That's
over the place.
yeah, but look how close together they are. Those are spikes. But as you can see, the spikes came down.
It came down. Yeah.
Came down. It didn't prolong itself. So it came down in a reasonable amount of time. And that's what you want it to do. You want it to come down. That means that your pancreas is not overworking, spilling out way more insulin than it needs to bring those glucose levels down.
Mm-hmm.
So why this matters for metabolic syndrome is it shows real-time impact of food, and it reveals hidden spikes even in non-diabetics. We're not just talking about people with diabetes. We're talking about every last one of us.
Yes.
So the examples, hypothetically speaking, would be if you eat some oatmeal, you're going to spike because that's a carb, and it could spike up to 180. But if you eat an egg, it's not going to do the same thing. Protein and fiber, it's not going to do the same thing. Like if you eat something that has more fiber in it, it's going to help you. But the best thing to do, from what my experience and how I've been monitoring mine, eat your protein first. Let that be the first thing you eat, because if you eat the protein first, it's going to blunt. If you have some green beans or a little bit of cabbage or spinach after that, you won't see that spike. But if you eat some watermelon first, and then you eat a piece of cake, and then you later on eat your meat, yeah, you're going to see that spike. You're definitely going to see that spike. So insulin resistance means the body's cells don't respond properly to insulin. And I gave you the whole scenario if the pancreas could talk. So glucose builds up in the bloodstream, okay? The pancreas works harder and harder, and eventually this can lead to prediabetes and or type 2 diabetes. So connect, your body's response matters more than the label on the healthy food, because a lot of times people say, I'm eating healthy. I'm eating healthy. I shouldn't be, having these spikes like this. Well, if you are looking at your continuous glucose monitor, and or if you are monitoring your glucose by way of a finger poke, you're going to be able to see what the so-called healthy food is also doing to your glucose levels. Because no matter what the healthy food is, you want to see how your body responds to it. You want to connect it to blood pressure. You want to check glucose spikes, because glucose spikes lead to insulin spikes, which leads to blood pressure being increased. And chronic spikes equals long-term hypertension risk. So wouldn't you want to know if you are at risk for hypertension just by monitoring your glucose?
Yeah.
Like I said, it's outdated when they say, I don't have diabetes. I don't need to monitor my blood sugar. Okay. If you don't want to know what's going on in your body, that's why I've always said, know your numbers. Know all of your numbers and know what they mean. Do a deep dive study for yourself. Be an advocate for yourself, because a lot of times these doctors are not going to be the sole advocate. We need to be the senior executive officer of our health. If we know what's going on, then we can go in and tell the doctor, look, my blood pressure has been reading this, and this over the last month. Give them something to look at. What can we do about it? Or figure out what you can do about it naturally if you haven't gotten to the doctor yet, just so you will know. So the connection between glucose and blood pressure, these two are closely connected, like connected. High glucose levels damage blood vessels, making them less flexible. Less flexible means it's stiff. And you want flexibility. You want it to be flexible, to be able to move. You don't want it stiff and it's not moving and it's barely moving. You don't want that. This increases the blood pressure when it's less flexible. And at the same time, high blood pressure worsens insulin resistance. You're talking about a domino effect. Whoa. So you got the dominoes and they're knock one down and they all fall and you pick them back up. But well, guess what? What if you knock it down on this end? It's going to fall that way. They're so closely related. It worsens insulin resistance. It becomes a cycle that feeds itself. And that's not good. Anybody have any questions or any interjections they want to do? I can't see who's all on the call here. All I see is me and you, Deetra.
Oh, okay. We have Queen Alita, my Vanessa, and Sharonda.
Okay, awesome. So if anybody,
I just want to say, but you went right into it. I was going to ask if you're not dealing with, let's say, um, blood pressure, high blood pressure, or any of those other things. But then you went right into it that we should check those things anyway. So I should have a monitor around, and check. I should just check, know what my body is doing all the time, because that's the first thing that the doctor does ask is when did that start? When did you notice that? And I don't know,
Right.
that. But yeah, we should be checking and knowing what our numbers are. Know your numbers, period,
yeah,
around everything.
just think about it.
Is that one?
What is the first thing they do when you
Yeah.
go in the doctor's office after they take your weight?
Blood pressure.
And they want to know what your blood pressure is. And that's a very important indicator to them on how your body is working. So if you're going in for your yearly physical, how many times are they going to monitor your blood pressure?
Just that one time.
Once a year.
Yeah, so we got to be on the top of it ourselves.
Yeah. So if
But
you're
the
not the
one when you were
CEO,
saying about the spike, I mean, doing your e- either either the blood, the two different ways, and you were showing it the way that you do it.
mhm,
Yeah, I would never thought about that. I should be checking that.
yeah. Check, you mean the blood pressure?
No, When
Glucose monitor.
yeah, the glucose.
Oh yeah. Yeah, Evelyn wanted to get the teaching on the glucose monitor, and it's very important that we know our glucose levels because, like I said, once a year we'll go in and get our blood pressure, and once a year they're gonna take your blood work to see what it is. And if they don't see anything alarming with your blood work, they're not going to do anything because guess what could happen? You're going to go in and you're going to take your blood work. And what do they ask you to do before you get your blood work done?
Um,
Fast.
Fast?
They want you to fast before you do your lipid, not necessarily the other stuff.
Right.
But to do your lipid profile, your cholesterol profile, they want you to fast. They want a fasting one. Because if they use a fasting glucose or a fasting lipid profile, they can see what's going on in your body when you haven't eaten in a long time. Now, if your numbers are real high and you haven't eaten in a long time, then they know that your body has been doing some damage over time.
Right.
And they got real numbers over the last year of what your body has been doing over
Whoa.
the last year because you have high levels when you haven't even eaten none. Your triglycerides is off the ripping chart, and you done fasted for 12 hours. They're looking at that. Okay, so if you don't fast, it's going to be even higher, and it don't give them an indicator of your true number when you're not fasting. But what about the numbers every day of the year after that visit?
Exactly.
Well,
And
how are we going
Stacy,
to know what our numbers are on a daily basis, weekly basis after that visit? How do you know if your blood pressure is high? Because you don't have no symptoms. Most people say they know when their blood pressure high because they have a headache or they feel tired or weak or fatigued. That's how they know they have high blood pressure. Some people don't get no symptoms whatsoever. And they walk around with the silent killer on the inside of their body. And they're not monitoring it. They don't know what it is. They're not taking medication for it. And your body is day by day in decreasing in its functionability. Deetra, did you have
yes, yes,
a
yes.
question?
I just wanted to let everybody know that you can easily get this. I check my blood pressure daily. And I also have a glucose. I prick my finger daily, so
Mm-hmm.
I check that. So it can be done. You can
Yeah.
keep numbers on those things in
Mm.
your home,
Mm-hmm.
without going to the doctor first.
And it's not that expensive. And some people who have insurance, check out your insurance and ask the insurance company if they could give you a glucose monitor and or a blood pressure cuff. Because you'll be surprised. If you have a diagnosis of high blood pressure, they will give you a monitor. You just
Oh
need to
yeah.
check with your insurance company and say, hey, send it to me. And they also have little programs too that you can sign up for. I belonged to one program till I didn't. It kicked me off because they no longer provided it anymore. But I belonged to a program where I had at my disposal the opportunity to have a dietitian on board,
Oh, nice.
someone to be able to coach me along the way, someone to share my numbers with and talk about how we're going to move forward and getting those numbers down. And my insurance paid for all of it. So
Oh,
know what
that's
you're
great.
entitled to with your insurance as well, because that could help you along the way to obtain it. But if you can't do it, if you can't afford a continuous glucose monitor because they won't give those to you generally unless you have a diagnosis of something like pre-diabetes or diabetes. I lucked up getting it because I had the bariatric surgery. So me having a bariatric surgery, they have to follow me for the rest of my life. And they follow you in the metabolic clinic. And so they have to follow all of my numbers. And so I said, well, I need a continuous glucose monitor. So it was easy for them to write me a script. So I always know what my numbers are.
Yes.
And I'm very thankful for that because I'm not going to do without it. And yes, it cost me money. It cost me $140 the other day, but I got a 3-month supply. So to me, that wasn't bad to be able to know what my numbers are every time I eat something.
Right.
So these are closely connected. Like I said, the high glucose levels damage the blood vessels, making them more flexible. This increases blood pressure. At the same time, high blood pressure worsens insulin resistance. It becomes a cycle that feeds itself. So putting it together, lifestyle strategy. The focus here is on actionable steps. What steps of action can I take? What strategy can I use in my lifestyle to be able to help me? So number one is nutrition. Lower your refined carbs. Some people will say get rid of them altogether. Throw them out the window, get them out the pantry, take them out the refrigerator, do what you got to do. Those refined carbs are not your friend.
No.
Prioritize protein plus fiber. And yeah, I eat protein first nowadays. But I'm going to tell you, I need the fiber. I don't know about some people, like everybody's body is different.
Yeah.
And I try to do between 150 and 163 grams of protein a day so that I can lose weight to get half of my body weight in protein grams. And when I tell you, that don't work for me. Number one, it don't work for me because my stomach is smaller. Number two, it doesn't work for me because I need fiber. What does fiber do? Some people say fiber are for farts. Yeah. Too much fiber will make you fart, for sure.
It's good for
But
elimination.
when you fart, that means air is going through your intestines.
Yeah.
You know, your intestines are moving and the air is getting through and you spin it out. The air, it's just air. But if you don't have fiber, it doesn't soften things and keep things moving along. And too much protein, for me, that's me. If I have too much protein, my vagus nerves get stimulated in a place where I don't want to stimulate it. I can fall the heck out from pushing too hard, keeping it 100. If you pushing too hard, you ain't got enough fiber.
Right.
If you're not going to the bathroom every day, having a bowel movement, you don't have enough fiber. So you reduce the sugar. This is a big blood pressure impact. Reducing sugar. Sugar is not your friend.
Right.
The second thing is movement. Walking after a meal lower glucose spikes. I wish I could walk after a meal. I don't know what it is with me, and it's been that way for a long time. If I eat something, maybe it's because I ate too much. But if you walk after a meal, it lowers the spike. If your spike was going to do this after you ate that watermelon, if you walk after it, it may do this. So the spike won't be as bad. Resistance training is what Deetra talked about last week. It improves insulin sensitivity. We want to have insulin sensitivity, not insulin resistance.
Yes.
And if we are overweight, we want to reduce that weight by even 5 to 10%. If we could lose at least 5 or 10% of our weight, it improves the blood pressure and it also improves your glucose. And this one right here is very important. Sleep and stress. Ooh-wee. If you don't get enough sleep, you're going to have more stress. You have more stress, you're going to increase your cortisol levels. You increase your cortisol levels, you reduce your ability to be able to lose weight like you need to be able to. So poor sleep raises insulin resistance, and poor sleep, who would have thought, raises your blood pressure.
Mm.
You don't get enough sleep, your blood pressure, if it's already high and you ain't getting enough sleep, ooh wee, ooh wee, ooh wee. So common factors include the poor diet. This is the common factors: poor diet, physical inactivity, obesity, especially abdominal fat, chronic stress, smoking, and genetics. Genetics play a role in it as well. But in genetics, we all know that we can determine how our genetics is going to act, because there's a such thing called epigenetics. Because your mom or your dad had diabetes don't mean you need to get it. Epigenetics means that your body, how can I explain this? Epigenetics is you can determine how your genes are going to respond by what you do. So if you don't eat like your parents ate to give them diabetes, and you change your diet, you can change how your genes express themselves. So your genes can be predisposed to diabetes or high blood pressure, kidney failure, and all that kind of stuff. But can you change how that gene expresses itself? That's what epigenetics is all about, changing how your genes express themselves. So warning signs. Here's the tricky part. There often aren't obvious symptoms. Some people may notice fatigue, increased thirst, headaches, but many people feel completely normal. And people, if they feel that way all at night, that's their normal. I don't feel no different than I've been feeling. It's normal for me. That's why screening is so very important. Prevention and lifestyle, the most powerful interventions are based on your lifestyle. A balanced diet, regular physical activity, weight management, reducing your sodium, managing your stress. That one's a hard one for me. If you got stress in your life, sometimes it's really hard to manage it. Limiting alcohol can significantly improve both your blood pressure and your glucose levels. So home blood pressure monitors and glucose tracking tools give people, like I said, real-time feedback. This helps individuals see how food, stress, sleep, and activity impact their numbers. I'd like to see how it impacts my numbers when it comes to exercise, and I haven't yet tried that yet. I haven't yet ate a meal and then jumped up and went to go for a walk. Because after I eat a meal, I'm like, it's time to lay down now. And that's what I want to do. I want to lay down after I eat. I don't get up and go for no walk. I like to do that stuff in the morning. But, I'm going to test it out. I'm going to see, maybe if you can test it out, like you do something predictable, something regular. Like if you ate this meal today and you didn't go walk, eat the same meal tomorrow if you meal prepped, and then go walk and see the difference in your blood sugar and your blood pressure. See how it has impacted both of them if you intentionally set out to do or to track how your body is responding to these things. So if blood pressure and glucose levels remain elevated, it's important to involve a healthcare provider because medications may be necessary. I take a blood pressure medication. Do I want to? No. But if I miss my blood pressure medication and I see my blood pressure went up the next day or even that evening, I'm not taking no chances. There are some things that you can do naturally, but sometimes it takes a long time and it takes consistency. So if you're not going to do something naturally and over time be really consistent with it to see the benefits of it, you need to involve a healthcare provider. Because like I said, medications may be necessary and early treatment can prevent serious complications down the line. Practical tools. Okay, something to do tomorrow. Everybody can do this tomorrow. Matter of fact, you can do this today. You can do this after we get off of this call. Check your blood pressure at home. Check it in the morning when you get up, and check it at night in the evening. And then, like I said, try a 10-minute walk after meals. And then track how certain foods make you feel if glucose is available, okay? Sometimes we know that after we eat a bowl of ice cream, what it makes me feel. Can somebody give an example of some food that they have tried and how it makes them feel after they eat it?
Chips, popcorn. I feel like it was too much.
Mm-hmm.
Yeah, so I don't do it anymore, so that's a good thing.
Potatoes.
I know. Yeah, that's a
I absolutely love potatoes. Oh
Yeah.
my goodness. And I figured out a way to fry potatoes without frying potatoes, fry them in the air fryer.
Okay.
And they taste just as good.
Oh yeah, let me tell you how I do it. So what I do is I cut the potatoes up and I put them in vegetable broth and I put it in the frying pan along with the onions, okay?
Mm-hmm.
And I'll let the potatoes cook with the onions. And then I take them out of the water and I put them in the air fryer and I spray it down with a little bit of avocado oil because avocado oil can stand high temperatures.
Ah,
Yeah, so I
I
put
didn't know.
avocado oil on there and I close that thing down. And when I tell you, I like my potatoes, my fried potatoes, like a kind of crispy burnt.
Yep.
The burnt, the better to me.
Yeah, I like that
Or they
too.
have to be dark brown. Yeah, they taste so good. So I pop the lid open and I see if it's burnt. I'm like, and I take them out and I eat them. And they don't affect my blood sugar that much. And another thing you can do, like with rices and potatoes, because they are ones that could spike your blood sugar, if you make a pot of rice, if you want some rice, you can cook that rice and put it in the refrigerator. And if you put it in the refrigerator, if you put the potatoes in the refrigerator, it decreases how your body will respond to a glucose spike.
Oh
It's
wow, and that's the
much
same for
less.
potato.
It's much less.
So once you put it in the refrigerator, did you heat it up once you take it out the refrigerator?
Yeah, you can heat it up after you take it out. It's putting it in the refrigerator that kills the ability for your insulin levels to be high, your glucose levels to be high, or your pancreas producing more
Mm-hmm.
to bring it down. It works. There's something about cooling it down.
Okay, that's the
And they
same
say
for
if you like cool it down and just eat it the next day. Don't even eat it that day, and see if you're monitoring how it affects it. And it doesn't affect it by that much. But we definitely want to track how certain foods make you feel. After I get done eating the potatoes, like I say, it's time to lay down now. That's how it makes me feel very relaxed.
Oh.
Comfort. That's why they call it comfort food. I be feeling good. Chill out. I love potatoes. But I have the continuous glucose monitor so I can see my numbers in real time and I can tell whether or not my glucose levels stay elevated for more than 2 hours, and they don't.
Oh, good.
Yeah. So ask your doctor about getting a continuous glucose monitor, even if you want to do it for short-term use. You can say, hey, doc, I want to monitor what my glucose levels are doing. Give me a prescription for one. And if your doctor don't give you a prescription, go over his head. And the way you go over his head is there are so many people on YouTube or online that will sell you a continuous glucose monitor. And you can monitor it for a month, 2 months. You can just decide how long you want to do it. And you can monitor it yourself, but it's going to cost you a cost that is well worth its price in gold. So definitely get you a blood pressure monitor, Get you a glucose monitor. If it can't be a continuous glucose one, go to Amazon and buy one. You can get one for under $100, and you can buy the strips. You can monitor your glucose and your ketones. And they'll give you both strips, and you'll know what your body is doing. You'll know if you're making ketones to burn fat. You'll know if your sugar is high or if it's low. And it's worth it. So if you don't have it, get it, because we don't want silent killers creeping up on us. We don't want years and years of not knowing what our body has been doing to just creep up on you all of a sudden out of the blue.
Right.
So call to action here. We got a call to action. So what am I saying here? Metabolic syndrome, high blood pressure, diabetes, all of that is reversible. You can turn it around. It's manageable. Blood pressure and glucose are two of the most important drivers. The earlier we identify and address these, the better the outcome is. The earlier you catch the signals, blood pressure, blood sugar, the more control you have.
Okay.
Now, who wouldn't want control over their own life?
Hey.
Who does not on this call want to be the CEO of their own health? Because the doctor is doing him all year long, and he only gonna see you once a year. And
That's
he don't know what you've been doing all year long.
That's true.
And you don't have time to tell him. And he ain't got time to listen. You got 15 minutes and you out. The best thing you could do is make sure you're the first one in the morning. He might give you a little bit more time.
Right.
When I went to see my doctor a couple of weeks ago, man, I felt like I was special. I was the first patient of the day. And when I tell you, she gave me her undivided, fresh morning
attention.
She gave me the first of her. I was that girl. She asked me all kind of questions, gave me all kind of advices online with what I'm doing, holistically speaking. She's online with me, doing the keto way of eating. You know what I'm saying? She's online with that. And, there's different ways you can do keto. You can do high fat, high protein, low carb, or you can do high protein, low fat, low carb. I choose to do high protein, low fat, and low carb. Why? Because for me, if I take in too much saturated fat, my cholesterol go through the roof. I tested it. I went and got my own blood work done outside of my doctor. I went to a lab that's here in Ann Arbor, not too far from me, and I had them run my numbers because I wasn't waiting a year. I wasn't waiting 3 months. I wasn't waiting 6 months. I wanted to know what my number said now. It cost me money. I was willing to pay to know what my numbers were. And I tell my husband all the time, because he has kidney failure, keep your blood pressure down. The longer you can keep your blood pressure down, the longer you can keep your glucose levels down, the longer you can avoid needing dialysis. Because if you have chronic kidney disease, you want to control it so it doesn't get worse. Because if you get to the point where you have to do dialysis, you're on it for the rest of your life. Maybe not. So I've heard of some people that had dialysis and were able to come off of it.
Really?
Yes, I've heard of it.
Wow.
Yeah. So blood pressure is a key factor. Glucose levels is a key factor. Those two work together synergistically, and they help you keep your body in check, because metabolic syndrome affects every organ in your body. So know your numbers, monitor your numbers, and, report the numbers to yourself first and foremost. And if you can't get it under control, involve your doctor. But it's a lot of things that we can do ourselves before our doctors are even involved. And we can go and show our doctors what it was that we've done to get things under control. Because they put me on cholesterol medicine, and I told them I didn't want it. And then I said, hey, I'll do it. She prescribed it. I went to pick it up and I never took it.
Yeah.
6 months later, my glucose, my cholesterol levels were down because of the way I ate. And she's like, "Are you still taking your cholesterol medicine?" I said, "I have to be honest with you. I wasn't going to tell you, but yeah, I'll tell you. I've never taken them and I don't want to take them." I said, "I've used diet to get my numbers the way it were." And she was looking like, "Oh, like what
Right.
to say to her, besides keep doing what you're doing, keep up the good work."
Mm-hmm.
And that's what I plan on doing. I plan on keeping up the good work because I don't need my blood pressure being high all the time. I want to know what it is morning, noon, and night. So I'm going to bring us back together. Uh, Stop the share. Um, my screen. Stop share. I think I
There
don't.
we go.
You
I
got
know how to do
it.
it now.
Well, thank you, Nurse Stacy. This was
You're
great.
welcome. I
Yeah.
hope you all got a
Yeah,
good.
thanks for sharing. Now I have missed some. How do I go back and look back?
I didn't push the button to record it, but I
I
believe
do. I have it.
Queen
I'll
has.
send it to you, Alita. I was just
Okay.
thinking earlier that I was going to start posting the show, everybody's show right after once I upload it.
Mm-hmm.
Just throw it in the chat. You're not in the chat though, Alita, right?
I don't think so.
Would
Well,
you
wait a minute. Where is your chat?
in WhatsApp?
I think so.
You do?
Yeah, hold on. 'Cause I think sometimes. Here we go. Let me see. Yeah, Grand Rising Elizabeth.
Okay, yeah. I'll start posting our shows in there.
Okay, great.
Yeah, so you can just grab it and then we'll get it together around. I'm still working on the website, so
Okay.
yeah. This is a
Yeah.
good show, Stacy. That's some good information. Very
Yeah.
good.
Yeah.
Thank you. Thank you. And
Mhm.
It
Alicia,
was.
you
I
all
can't wait
can.
for you to record it so I can look at it.
Mhm. All right.
Ladies, let's give ourselves a hug. This
Mhm.
hand is hugging for the glucose, this hugging for the blood pressure. We're going to
Right.
monitor both of them. Give ourselves a hug,
Yes.
take
Yes.
care of our health, and tell the world about how they need to monitor both of them together because they are linked.
They are.
Give that love to the
Okay.
world and tell them how important it is to be able to know numbers.
May I say something?
Yeah, I'm gonna say before we take off, Lakeisha, make your announcement.
I
Oh.
just wanted to say Stacy just looks so beautiful
Hmm.
and vibrant this
Hmm.
morning.
Thank you. I
Yeah.
wish I felt like I looked.
Oh. Oh. Okay. Well, would they
Thank you.
say
Thank
fake it
you.
till you make it?
Yeah, I feel
Lakeisha, you
okay.
want to share about, because I don't think Alita knows about the class tonight.
Oh, what class?
Oh, yes, I'm so excited. Did an all-nighter pretty much. And that's why I kind of missed the show. I was trying to stay up until after the show. But I'm excited. There's only 3 tickets left this morning.
Whoa.
And so it's almost 60 people that can attend. The place can hold 80 people, but I'm not gonna open it up anymore. A couple people said it was closed, sold out yesterday, so I opened it up and added a few more people. But yeah, it's gonna be fire. It's gonna get a lot of amazing worksheets that you will be able to take with you, to take home, to be able to put what I call in your wealth building binder. Um, and it's some really good information. I'm excited about it. Um, Yeah, I'm just
Where's
really
it gonna be?
excited. It's gonna be very interactive. It's not no listen to me speech. Everybody is gonna be involved. It's called the Generational Wealth Building Blueprint series. Has 2 series. The first series is today, May 5th. The second series is May the 12th. And the second series is going to be the icing on the cake. So I'm excited.
Good for you.
Yeah, it's about generational wealth, different things that you can do to maybe make a small life insurance policy to use it as a seed where it can multiply from years to years to years to come.
So if you attend today, if you don't aren't able to attend today, uh, can they come next week?
They can. So what I did was everybody would have to re-register. So today it was registered for May the 12th. After tonight, then people can start registering for, I mean,
Me.
today, May the 5th.
Mm-hmm.
After today they'll be able to register for May the 12th.
And this is in person, correct?
Yeah, this is in person at the Conley Detroit Library. It's kind of near Michigan, and but it's on a street called Martin.
Mm-hmm.
It'll be in the basement. It'll be light refreshments. A nonprofit organization sponsoring the event. That's why it was free. So it took out people, not able to, not wanting to pay or can't pay. So it's being sponsored. So they're paying for the butts and the seats.
Okay.
And yeah, I'm excited. Light refreshments.
Thank you, Lakeisha.
Hmm.
Well, Lakeisha, you get some rest and stuff.
Yeah, I'm about to go back to sleep. I'm like, oh my God, I know I missed it now.
Because
No
I know
worries.
you're excited, so your adrenaline is already running. But
I
your body
know.
needs the rest of the mind. I'm looking forward to it. I just got to get my ride because my husband has a gig already. So
Okay, okay.
I'm about to call somebody and call Mama Evelyn because she always gonna be early on time.
I'm
Yes,
surprised she's not here.
yes,
Right, and you too, Deidre.
yes. Dietrich, yes, she's definitely gonna be on time.
On time, early, early. All right. Peace out. Love you all.
Love you too.
Thank you.